Namaskar, this is Dr. Hema Divakar, Senior Consultant and Obstetrician and Gynecologist at the Divakar Specialty Hospital, JP Nagar, Bengaluru. So what is FIGO doing about this problem? Well, it has a three-pronged strategy. Being in the working group of hyperglycemia and pregnancy, the strategy three-pronged from the international organization is firstly on advocacy. Both the demand side and the supply side is being strengthened on advocacy, as in speaking to people and letting them be serious about this problem, which means the women should know, the society should know that this is a concern, the doctors and the healthcare providers should know. So both the demand and supply is being strengthened by speaking about it, that is the advocacy. The second is the capacity building. It is not enough if they know about this problem, there should be enough training or the capacity building of the healthcare providers who would now know when to test all our pregnant women in pregnancy, at booking and in the middle of a pregnancy. What is the methodology of testing? Giving 75 gram glucose, drawing her blood sample in 2 hours, and what do they do with the test reports? In case the sugars are high, what next? What is the diet advice they will give? What is the exercise pattern they will teach? How they will ask her to monitor and control her sugars? What is the special care that they will give to the baby in the womb? What are the points that they will take care during her delivery process and even beyond that? So that is the second important component of capacity building. And the third component is research. Because this is a new era problem and the numbers are scaling and the volumes are getting higher and higher, we need to find out by some more research how to operationalize this entire care in developing countries. That is one prong of research. That means already the known issues, but how we are going to reach it to the women out there. And the second prong of research is there are many nuances in the origin and care of hyperglycemia in pregnancy. So when the question of what next has to be answered, could there be a promise in the gene therapy? Could there be new medications which can be offered to the women rather than the insulin injections? Could there be some form of preventing this before she embarks into a pregnancy? Could there be better tests? Could there be quicker methods of solving? So all this is a huge potential for the research area, which is the third prong of attack of the FIGO working group of hyperglycemia in pregnancy. Very soon, we know that everything cannot be achieved in 1 day or 1 year, because the large numbers of population that we are talking about are really massive numbers. We need not only a massive workforce, but we need the help of every stakeholder, may it be the medical professionals, may it be the society and the responsible behavior of the women and the families themselves, may it be the government, the NGOs, the policy makers, the entire professional organizational network in the entire country. Remember, we are speaking about hyperglycemia in pregnancy, which means that this is a pregnancy situation we are speaking. And when the woman is pregnant, whom does she seek help from first? That is the gynecologist or the obstetrician. So we are the primary focus, the primary caregivers, the central point, the pivotal point in this entire issue. Therefore, FIGO has taken this responsibility onto itself, trying to do their best before, during and beyond pregnancy to get a strong control on hyperglycemia in pregnancy. This is Dr. Hema Divakar, the FIGO co-chair for the gestational diabetes mellitus issue, recoined by FIGO as HIP or hyperglycemia in pregnancy. Watch the space for better developments and better care of the generation next.